Welcome everyone to the webinar today on addressing cannabis and tobacco secondhand smoke in multi-unit housing. My name is Liz Hendricks, and I am the Chief of the Strategic Planning and Policy Unit at the California Tobacco Control Program. On today's webinar, we have three great speakers. We have Liz Williams from the American Non-Smokers' Rights Foundation, who will be talking about the sources of secondhand smoke in multi-unit housing and the health and equity impact of exposure to secondhand smoke. Next, we have Andrew Twinamatsiko from the Law and Policy Partnership to End the Commercial Tobacco Epidemic, who will talk about policies that can be implemented to reduce exposure to secondhand smoke. And then finally, we have Paul Neprath from the California Tobacco Endgame Center for Organizing and Engagement, who will talk about the available resources for community engagement on this issue. Thank you all so much for taking the time to tune in today. As mentioned earlier, we will hold questions until the end, but if you have a question, please feel free to put it in the chat at any time, and then we will get to all the questions at the end of the webinar. So that's it for me. I am going to turn it over to Liz Williams from the American Non-Smokers' Rights Foundation, who will get us started.
Wonderful, thank you. I'm going to go ahead and share my screen. Here we are. All right, wonderful. Well, thank you very much. And as Liz said, I'm Liz Williams with the American Non-Smokers' Rights Foundation. We're a nonprofit organization that is based in Berkeley, and we've been around for more than 35 years. We provide support to health departments and coalitions and communities who are working to support everyone's right to breathe smoke-free air, whether that is on the job or at home. And I'm really glad to have this opportunity to talk with you today about addressing all types of secondhand smoke in multi-unit housing. We want you to have the information and resources you need to assist your communities as they consider expanding smoke-free air protections for multi-unit residents. So to give you a brief overview of what I'm going to talk about, well, first I'll review why smoke-free multi-unit housing is important and the problem of secondhand smoke in housing. Next, I'll highlight concerns around e-cigarettes and vaping. Then I'll talk about the risks of secondhand marijuana or cannabis smoke. And lastly, I'll mention resources on these topics. And before I start, I do want to address the terms marijuana and cannabis. Both are in use around the country, and we recognize that there can be strong emotions and strong preferences for using one word over the other. Our organization has been discussing which terminology to use over the years, and we know others are as well. We primarily say marijuana, but we also do say cannabis at times. And we encourage you to listen to your community's opinions to determine the best terminology to use. So let's begin. So smoking in multi-unit housing is an important issue to address because of the known health risks associated with secondhand smoke exposure. There's also a large number of people who remain exposed at home. That especially includes children, older adults, and people with disabilities. And we know that the home is really one of the last places where people are still regularly having to breathe secondhand smoke. We also know that there is no safe level of exposure to secondhand smoke, and the Surgeon General confirmed that even low levels of exposure and occasional exposure can be harmful to health, which is the type of exposure people may be experiencing in a multi-unit housing environment. There's also well-established evidence that shows that secondhand smoke has numerous short-term and long-term health risks, and this includes worsening health conditions like cardiovascular disease, asthma, and other respiratory illnesses. So let's look at secondhand smoke exposure specifically in multi-unit housing. So people who live in multi-unit buildings can be exposed either from family members who smoke in the unit or from neighbors whose smoke is drifting into their unit. And research shows that secondhand smoke really can travel all throughout the buildings. That can include through doors and windows and hallways, but also through ventilation systems and ducts, through electrical outlets, and even in gaps in and around fixtures and pipes. In fact, research has shown that up to 65% of the air in any one apartment unit may be coming from other units in the building. There's also no known ventilation systems or standards that can effectively prevent the health risks caused by secondhand smoke exposure. So what this means is that the only way to protect health is for buildings to be completely smoke-free indoors. We also know that many people remain exposed. 31% of Californians live in multi-unit housing, and that means that there's around 12 million people in the state who are at risk of breathing their neighbors' drifting smoke. A study by the CDC researchers estimated that between 44 and 46% of the non-smokers living in multi-unit housing in California are exposed, and the rate of Californians reporting exposure to tobacco smoke, e-cigarette smoke, and marijuana smoke increased between 2016 and 2018, and that's according to the online California Adult Tobacco Survey. Another CDC study found that more than a third of multi-unit residents who don't allow smoking in their own home are still experiencing secondhand smoke drifting into their unit. And then there's a 2015 Vital Signs report that looked at disparities among who is still exposed to smoke, and it was very significant. The findings included that 2 out of every 5 people who live below the poverty level are exposed, which may include people who are more likely to live in multi-unit housing. And also it found that 7 in 10 Black children remain exposed. And we know that the home is the primary place where children are breathing secondhand smoke. Also, it's important to note that residents really want smoke-free living and are asking for smoke-free housing so that they and their families can have a healthier and safer living environment. Drifting secondhand smoke in an apartment or condominium is the #1 complaint that we receive at the A&F Foundation, and many health departments and landlords are also hearing from residents about this problem. Residents are really asking for help to make smoke-free air in their apartments a reality. And it's helpful to know that in California, 90% of adults don't smoke tobacco, and 87% of California multi-unit residents don't smoke. Likewise, the online California Adult Tobacco Survey found that 70% of Californians believe that apartment units should be both smoke-free and vape-free. And California surveys have shown that Latinos report both the highest levels of exposure to secondhand smoke at home, but also the highest levels of support for smoke-free housing. In particular, a study by USC found that tenants in Los Angeles are being exposed to marijuana smoke and e-cigarette aerosol in addition to tobacco smoke, and the majority of the tenants surveyed would prefer to live in a smoke-free environment. So all of this data really speaks to the fact that smoke-free multi-unit housing is a health equity issue. People living in multi-unit housing without a smoke-free law can't guarantee their ability to have a smoke-free living environment because that choice can just be taken away by their neighbors drifting smoke. Smoke-free multi-unit housing can help address health inequities in lower income populations and communities of color who studies show have higher rates of exposure to secondhand smoke and also higher rates of health conditions that are negatively impacted by that exposure. Surveys also show that lower income populations have a high desire for smoke-free housing, but that there is less affordability of smoke-free affordable properties, so the demand for smoke-free housing typically exceeds the availability of it. Also, we know that moving out of a smoke-filled apartment just simply may not be a financial or practical option, and that's especially now the case that we have so many communities facing an affordable housing crisis, and of course that we're all dealing with a pandemic as well. And overall, we want everyone, regardless of their financial situation, to have the right to breathe smoke-free air at home, not just people who can afford to live in a freestanding house. So there are many health benefits to living in a smoke-free building. Overall, smoke-free buildings create a healthier living environment for all residents, and that includes people who smoke and their families. More specifically, smoke-free buildings can reduce people's exposure to secondhand smoke, which can improve residents' health and even reduce healthcare costs. Smoke-free buildings also support people who want to quit smoking or even cut back on how much they smoke. And smoke-free policies can also result in cleaner and safer buildings by reducing smoke damage and the accumulation of toxic third-hand smoke residue. And they can also reduce the risks of having deadly and costly and really disruptive fires. So overall, smoke-free buildings can help improve access to healthier living environments in our communities, and that's especially the case when they're enacted at a city or county level rather than on a building-by-building level. So now I want to highlight 2 products that need to be considered when discussing smoke-free housing laws and policies. First is e-cigarette use, or vaping. So you probably know that vaping is the use of electronic smoking device like an e-cigarette or vape pen, all sorts of different brands like Juul and other products. And when a person vapes, it releases aerosol into the air. So the usage rates of these products has increased dramatically over the last decade, and there are concerns not only about the health impact on people who use the product, but also about non-users who are exposed to that aerosol that the products are emitting. So vaping in indoor spaces, including multi-unit housing, really is a concern because that secondhand aerosol is not harmless. It contains nicotine and hazardous ultrafine particles that can be breathed in and lodge deeply into the lungs, as well as numerous chemicals and toxins that can cause lung disease and cancer. And then there are many health risks that are associated with vaping that are being uncovered that are even specifically posed by the many different flavoring chemicals. So the body of science is showing many health risks from breathing secondhand aerosol, especially risks to the respiratory and cardiovascular systems. Also, the refillable cartridges in refillable e-cigarettes, they can be used to vape not only nicotine, but also marijuana and other substances, so that can also be an additional concern. And studies have found that aerosol can drift in buildings and then deposit onto surfaces, so those chemicals can linger and then re-emit back into the environment, which also increases concern about both secondhand and third-hand exposure to those chemicals. And we believe that vaping products should not be used in smoke-free spaces, including multi-unit housing, in order to protect residents' health. The second key issue is marijuana smoke. So to start out, I want to be clear that marijuana is definitely a complex issue, and we're not here to take a stance on legalization or even on adults using marijuana, but we are very concerned about exposure to secondhand marijuana smoke and not using marijuana in ways that harm other people. And that's because when marijuana is smoked, just like when tobacco is smoked, it produces smoke that goes into the air and can be breathed in by other people. And breathing it is especially a concern in indoor environments, including apartments and condominiums. Secondhand marijuana smoke contains many of the same chemicals and cancer-causing substances as secondhand tobacco smoke. And that includes things like 3 times the amount of ammonia and significant levels of toxic chemicals like mercury, lead, formaldehyde, and cyanide, hydrogen cyanide. In 2009, California determined back then that there was already enough information to add marijuana smoke to the state's Prop 65 list of carcinogens and reproductive toxins. Likewise, more recent studies have led researchers to believe that secondhand marijuana smoke and secondhand tobacco smoke may have similar harmful health effects due to the fact that they have a very similar chemical composition. And that includes contributing to heart attacks, strokes, and atherosclerosis, or hardening of the arteries. It's important to know that breathing in any type of smoke is harmful to health, whether it's from tobacco or marijuana, or also wildfires and vehicle exhaust. So marijuana smoke, like all other kinds of smoke, as well as aerosol from vaping products, contains fine particulate matter, which poses many health risks to non-smokers. That's because these fine particles can be breathed deeply into the lungs, which can cause respiratory irritation, asthma attacks, and respiratory infections. And also, it can make respiratory conditions worse, things like asthma and bronchitis and COPD. So the researcher, Dr. Matthew Springer at UCSF, I think put the issue pretty clearly by saying smoke is smoke. Both tobacco and marijuana smoke impair blood vessel function similarly. People should avoid both, and governments who are protecting people against secondhand smoke exposure should include marijuana in those rules. And again, we recognize that marijuana is a complex topic. We know that some people use marijuana for medical reasons, and we also don't want any smoke-free policies to be focusing on taking a punitive approach. And with marijuana, that especially is a concern around targeting of Black and Brown communities for marijuana use, which has historically been a significant problem. Nor do we want to be putting anyone's housing stability at risk. So we do believe that communities should care about marijuana smoke in multi-unit housing for a variety of reasons. First is that the legalization of marijuana in states like California is increasing people's exposure to drifting marijuana smoke, and marijuana smoke is specifically increasingly being a source of complaint in the housing environment. The California Tobacco Control Program found that between 2016 and 2018, the rate of Californians reporting exposure to marijuana smoke nearly doubled from 21% to 40%. And this data point isn't specific to housing, but it does reflect a general increase in the exposure in people's daily lives. And as I mentioned earlier, marijuana smoke is a frequent source of resident complaints to health groups like ours, to health departments, to landlords, and increasingly to city councils. And the fact really is that buildings are not completely smoke-free if marijuana still can be allowed in the buildings. And smoke-free spaces should be free from all types of smoke. Just like with tobacco smoke, people should not have to breathe someone else's marijuana smoke in their home. And again, legalization does not have to mean that marijuana smoke should be used in ways that harm other people. If people need to use marijuana medically, then non-combustible forms might be considered for them to use. Also, we don't think that the default should be to allow marijuana smoking and vaping indoors. One community included language in their smoke-free housing ordinance that permits people to smoke medical marijuana in an outdoor smoking area on the property if their doctor says that non-smoked forms are not a suitable option for them. So that illustrates how there's really still an opportunity for communities to think creatively while still keeping indoor spaces smoke-free a priority. I also want to mention COVID-19 in relation to smoke-free housing. It's important to know that smoking, vaping, exposure to secondhand smoke, and COVID-19 all negatively impact the respiratory system. There's the well-established evidence that smoking and secondhand smoke cause various underlying health conditions, again, especially to the respiratory and cardiovascular systems, and also smoking and secondhand smoke exposure compromises the immune system. And then emerging research over the last year has also found that these impacts of smoking and secondhand smoke exposure in turn may increase people's likelihood of contracting COVID-19. And then likewise, people who smoke, vape, or are exposed to secondhand smoke and get COVID-19 may be at greater risk of having severe respiratory symptoms and outcomes. So COVID-19 really also means that people are spending so much more time at home now than we ever did before. And instead of people spending their days in smoke-free schools and smoke-free workplaces, they may be at home, and they're now reporting increased exposure to secondhand smoke in their homes. Also, the pandemic has shown a brighter light on many health disparities in our communities, and those health disparities are putting people at even greater risk of COVID-19. So overall, we think that the respiratory risks related to COVID-19 means that it's now more important than ever before to prevent exposure to secondhand smoke and for communities to be taking action to ensure that people have healthy smoke-free living environments. So in summary, all types of secondhand smoke should be addressed by laws and policies for smoke-free multi-unit housing. And secondhand smoke is a form of indoor air pollution, and smoking tobacco, using e-cigarettes, and smoking and vaping marijuana all pose health risks to the people who are not using the products, but are exposed to the emissions. So therefore, we recommend that multi-unit residences should be free from all types of secondhand smoke. And communities can take action to protect resident health by including tobacco, e-cigarette use, and marijuana in their smoke-free housing laws and policies. Lastly, the A&R Foundation has a variety of resources available to you on our website that includes materials like the infographic you see here about secondhand smoke in multi-unit housing, as well as we have whole sections of our website that are dedicated to secondhand marijuana smoke and e-cigarette aerosol. And those pages include fact sheets that highlight the research on their health impacts and blog posts on latest news and policy trends. We also have model lease addendum language that includes definitions to include e-cigarettes and marijuana in smoke-free housing language. And we maintain a list of communities that have adopted laws for 100% smoke-free multi-unit housing. So these resources and many more are all available to you at any time on our website, which is no-smoke.org. And then finally, this is my contact information here. Please feel free to reach out to me if you have any questions, if we can be of assistance to you at all. And I'm now going to turn it over to Andrew Twinemit-Seco with the Law and Policy Partnership. And let me stop sharing here and turn it over to Andrew.
Well, thank you, Liz Williams, for a really good intro, because that neatly leads into my discussion on the legal policy aspects of regulating secondhand smoke that comes from tobacco, e-cigarettes, and cannabis. As Liz Hendricks already mentioned, My name is Andrew Twinamasiko. I'm a staff attorney at the Law and Policy Partnership to End the Commercial Tobacco Epidemic. The partnership is a joint initiative of the Public Health Law Center and the American Lung Association. We are funded by the California Tobacco Control Program to provide legal technical assistance in issues relating to tobacco and working towards ending the commercial tobacco epidemic. And by technical assistance, I mean doing research, working on policies, working on laws that are targeted towards helping communities to address and regulate commercial tobacco in their communities. So I want to take a step back, and really Liz laid out a good foundation for our conversation in health and justice as it pertains to commercial tobacco and exposure to secondhand smoke. Championing health equity really means that we move away from the individual-based paradigm to addressing social conditions that influence individual behavior. Only when we've thoughtfully sought to reorient and alter environments in which people live, in which people work, in which people recreate, of course, take into consideration the diversity and uniqueness of different communities across the United States and in California, we will be able to make meaningful steps in the path, in the arc of health justice. So solely focusing on social determinants of health, though, misses the bigger picture here. And social determinants of health and really naturally occurring phenomena, they are products of choices that people make politically. And so we have to go upstream in order to ensure that we are making laws, we're making political choices that create environments that will orient communities towards healthful results. And that's why the law is really important, because the law reflects policy choices that are made through the political bargaining process. So for today's discussion, we'll discuss laws addressing housing and smoking and how those laws can be reoriented to minimize health disparities and ensure equitable health outcomes. So Liz Williams, again, already did a wonderful job laying out the statistical disparities and health inequities in housing and smoking. Marginalized groups of people tend to be overrepresented in multi-unit housing, which makes them disproportionately bear the negative health outcomes associated with secondhand smoke. And so what we're going to do here, if the law really is a reflection of the political process, how can we reorient the law to address that? And so I'll take a step back in addressing different legal impediments that people have had in order to address secondhand smoke. And one of them is the argument that the law has been used to derail and bully communities into not addressing secondhand smoke and exposure to secondhand smoke. And so people always make arguments that, oh, there's a right to smoke, there's a right to smoke. But that law, that argument, if you look at it closely, really, and I'm happy to tell you that right now, every court that has dealt with this argument has found that smoking isn't a protected right under any federal or state constitution. And so, and I'm sorry if I'm going to be a little bit pedantic in this, because this is really important. People need to be equipped to know that this so-called right to smoke isn't really based in any sound legal doctrine. One of the main arguments I always made is that, well, the First Amendment protects the right to smoke. It is expressive conduct. You know that the First Amendment not only protects speech in terms of expression, but it also protects what they call expressive conduct. Some people might remember the case of Mary Beth Tinker. Mary Beth Tinker was a student in the Des Moines School District who wore an armband to school to protest against the U.S. involvement in the Vietnam War. although she didn't really speak, that action of wearing an armband was considered expressive conduct. So drawing a parallel on that idea of expressive conduct, folks who smoke have said, well, this is the way to express ourselves. And by regulating where I can smoke, you are impermissibly you're impermissibly infringing on my right to free expression. Courts have said that really isn't the thing. More recent, so another argument that is always made is that the smoking is a legal activity, and therefore my involvement in something that is legal is personal liberty that is protected by the Constitution. And more recently, we saw that a nuance of that argument when a group, a pro-smoking group from New York City called New York City Clash filed a law against the Secretary of Housing and Urban Development, challenging the hard smoke-free rule. And the argument that was advanced there was kind of a little cute. People were saying that we have a fundamental right to engage in legal activity within the privacy of the home. So they kind of tried to build that around the home and how the law has always protected the home, and intruding what can be done in the home is impermissible under the Constitution. The court rejected that argument. In order to ensure that that action is actually protected, the court says that not every legal action is constitutionally protected. Because people don't have a fundamental right to smoke, a government can permissively regulate smoking even within the confines and privacy of the home. Then lastly, another argument that always features into these conversations is the idea that we're all guaranteed equal protection before the law, and any action that differentiates between smokers and non-smokers violates the equal protection of the law. It's discrimination against smokers. And that argument, of course, hasn't really carried the day. Like, if you think about it, almost every law is discriminatory. And bear with me here. Think about laws pertaining to driving. You can't just drive. The law prescribes who can and cannot drive. Practice of medicine, different treatments of individuals who can pay tax and the amount of tax they can pay. All those laws make distinctions between different groups of people. It only becomes impermissible if the law makes what they call a suspect classification that the law doesn't really isn't justified by a compelling government interest. And that is when, laws pertaining that differentiate between people based on, for example, color, national origin, and those those limited discrete classifications that are impermissible. Otherwise, as long as something is the government can provide a justification for, which they call rational basis, laws that differentiate between groups of people that don't classify them in suspect classes are permissible. So laws have found that smoking and smokers aren't a protected class, and the law can regulate different groups of people as long as it can provide a rational basis for it. And there is, a really compelling basis for that. And Liz has already laid out the health effects and negative health consequences associated with secondhand smoke. And so the argument that there is a right to smoke isn't really an argument. It's just a red herring. And so we talk about another aspect of that always features into these conversations about the right to smoke and differentiations between groups of people based on their smoking status. And the idea here is that in the context of housing, is that individuals who regulate smoking should make a reasonable accommodation for people who smoke so that they can enjoy or smoke in spaces where smoking is prohibited. Now, what is a reasonable accommodation? Laid out the language there, which has been defined as a change in a policy, practice, or service that may be necessary for people with disabilities who have an equal opportunity to use and enjoy dwelling. A typical example of making an exception here would be a no pet policy, which could make exceptions for people who have companion animals or service animals. But reasonable accommodations are fact-specific inquiries. Each case has to be decided on its own merits. And what is reasonable depends on the circumstances. So, for example, Joe Exotic with his, big cats can't really ask that, given that the propensity to dangerousness, it would be unreasonable for a property owner to let the animal stay with him considering the dangers it presents. And so, that is a weird hypothetical, but the idea here is to kind of bring in what factors go into determining what is reasonable under the circumstances. So, is smoking or nicotine dependence a disability? And the cases around this question have been litigated, and no court has found that smoking or nicotine dependence is a disability. And additionally, some arguments have been made that people have underlying disabilities that could be ameliorated by smoking, and that is some argument that the industry has presented about calming people's nerves and things like that. But medically, smoking hasn't been established as having ameliorative effects on underlying disabilities. So that argument also is out of the window. And so, given the health effects, the negative health effects that Liz has laid out that are presented by exposure to secondhand smoke, would it be a reasonable accommodation to make an exemption to a smoke-free policy to allow smoking where it isn't permitted? And the question, of course, is how do you balance these? We've laid out, that there's no risk-free level of exposure to secondhand smoke. Secondhand smoke that's been causally linked to lung cancer, heart disease, and all these other ailments, including SIDS in children. Would it be reasonable to expose groups of people, a wide range of groups of people, to all these health hazards in order to let a person smoke for actually an activity that doesn't have any medically recognized health benefits? And the answer there is really no. The accommodation wouldn't be reasonable, so there wouldn't be any reason to make the exception. And Liz again laid out the idea about cannabis. And we know that tobacco and cannabis are different. Unlike tobacco, cannabis serves different health purposes, and that is great. So the question here becomes, if you have an underlying disability that cannabis ameliorates, would it be a reasonable accommodation? Should cannabis use be exempted from smoke-free laws? And as I mentioned prior, the inquiry is one of reasonableness. And as Liz said, smoke is smoke. We have laid out different negative health consequences associated with tobacco smoke, cannabis smoke, and e-cigarette smoke. And cannabis smoke has some of the same carcinogenic elements that are present in secondhand tobacco smoke. So the same idea is, would it be reasonable to expose individuals in multi-unit housing to the carcinogens present in cannabis smoke in order to allow an individual who has an underlying disability that cannabis can address? And really, that is a fact-specific question. And I'm going to, the idea there is that it's likely unreasonable because, of course, you are exposing other individuals to secondhand smoke. And by the way, there are other ways through which cannabis can be ingested without exposing other individuals to secondhand smoke. It's not. It can't just be smoke. It can be applied topically. It can be. You can use edibles and all those things. So that also, again, that's a fact-specific inquiry that has to involve different balancing. And e-cigarette smoke, of course, you have to follow the same rubric that we talked about. Is it reasonable under the circumstances, doing a fact-specific inquiry? Anyway, all of that to say that you hear conversations about reasonable accommodations, and when you're talking about laws relating to secondhand smoke, and individuals saying, well, what about reasonable accommodation? That is something that can't really be, let's say you're drafting an ordinance, legislated prior to the situation presenting itself. Each case has to be decided on its own merits. And so one of the things that we actually have laid out, the thing that we've laid out is that there is no impediment, legal impediment to adopting a comprehensive smoke-free policy that captures tobacco, cannabis, and e-cigarettes. In fact, California law specifically says that a landlord can prohibit smoking of tobacco products in and surrounding the building. And the main vehicle through which that can be achieved is the lease agreement, which lays out different obligations between the landlord and the tenant on what can be done. And so tobacco, regulation of tobacco, there's no legal impediment in California because the law specifically comes out and says, oh, you can do that. What about, we move to cannabis. So under Prop 64, it is not against state or local law to ingest or smoke cannabis. You know, Prop 64 was a decriminalization statute that, you know, allowed people who meet age limits 21 and above to ingest or smoke cannabis. And like I said, the courts have addressed Prop 64 have characterized it as a decriminalization statute. And that is important. It is a decriminalization statute. It's not really an affirmative grant of a right against which localities can regulate. When Prop 64 was adopted, it added various sections to the California Health and Safety Code, which outlines specific areas where cannabis smoking is prohibited. Specifically, it prohibits smoking cannabis in locations where tobacco is prohibited. And that restriction actually applies to both recreational and medicinal cannabis. So really, the local regulation of tobacco is coextensive with the regulation of cannabis smoke. And in fact, there is a strong argument that a local government in California may not permissibly exempt cannabis when it adopts a local law restricting smoking of tobacco in particular locations. There is a likelihood that would be impermissible to exempt cannabis when a locality adopts a smoke-free policy. And so, again, the idea that there are legal impediments to adopting policies that protect communities from secondhand smoke, from both tobacco and from cannabis, isn't really there in California because everything that we have talked about goes against that argument. And in fact, our friends at A&R, Liz Williams, they actually have laid out come up with a cool fact sheet that shows that by August 15th, 63 municipalities had enacted 100% smoke-free policies. So it's the train has already left the station. It's the path to achieving health for different communities adopting smoke-free policies. And that not only happened in California, as I mentioned, referring back to the case of NYC Clash, the Department of Housing and Urban Development adopted a regulation that restricts smoking of particular products within public housing agencies. And that law applies to a particular section that receives public assistance for purposes of housing, providing housing to particular groups of people. And that is a discrete segment called public housing agencies. And it prohibits certain tobacco products that are combusted. So that includes cigarettes, cigars, pipes, including hookah. And then the restriction actually applies to units, dwelling units, and associated other associated units, to the extent that it also creates a 25-foot buffer zone around places where smoking is prohibited. And the reason for that is scientifically, it has been shown that cigarette smoke reaches background stages around 20 to 21 feet. So in order to protect meaningful protect areas from where in which tobacco smoking is prohibited, you have to increase the buffer zone for 25 feet to guard against drifting smoke. And then when HUD adopted the rule, it applied to everybody. Nobody was exempted. There wasn't any the so-called grandfathering in. And what HUD said was that it's just setting the minimum requirements. So for example, HUD doesn't address e-cigarettes, and property owners can address that, can adopt policies that include e-cigarettes in their smoke-free policies. And as well as what California law does under HUD's rule, the smoke-free policy has to uses the lease agreement as the vehicle for enforcement. But we realize that although HUD has made these strides, there are inequities that it creates. For example, it limits its application to public health agencies, which is actually like a defined group of establishments that receive public assistance, and it leaves out, Section 8. It leaves out mixed finance, and it actually also exempts other PHAs that have converted through RAD. RAD is a program through which the PHAs can leverage private finance to revamp and rehabilitate the properties, because the federal government isn't putting any money in public housing, which is a really sad idea too. But that's a conversation for another day. So anyway, communities that are protected by the HUD are limited, and that's why other communities have to step in and address those deficiencies that the federal government has left. And so we know that it's permissible to adopt a smoke-free policy, especially for property owners. And so what if you don't, as a property owner? There are actually legal risks that are involved when a property owner does not adopt a smoke-free policy, does not restrict smoking in premises which they lease. So I'll talk about a little bit of the legal nuances involved here, so that folks can understand the dangers and the risks that are associated with permitting smoking to continue in a community. One, tenancy law generally embraces the idea that no one should be allowed or forced to live in an unhealthy or unsafe environment. So to ensure that rental property is fit for human habitation, the law requires that every lease agreement guarantee that the leased property is habitable. That is what is known as a warranty of habitability. Ideally, when you lease a home, you're guaranteeing to the tenant, the resident, that actually this place is fit for your habitation. There won't be any living here won't kill you or won't give you a disease. But as we know, secondhand smoke is associated with a lot of death and a lot of disease. So due to the health risks associated with exposure to secondhand smoke, some courts have recognized that in some instances, the warranty of habitability can be used to protect tenants from involuntary and continuous exposure to secondhand smoke. So that's a thing. Secondly, there's the idea of quiet enjoyment. When a landlord, when a property owner leases property, they relinquish the possession of the leased premises. In a sense, you have the right, as a tenant, you have a right to exclude everybody for the duration of the tenancy, including the landlord. The landlord can actually be sued for trespass if they enter the premises without consent. But by permitting smoking, a landlord could actually violate that warranty of quiet enjoyment because you are allowing a circumstance to intrude into the quiet enjoyment of somebody's property. Because if you guaranteed me as a tenant that I'll be living here peaceful, but you let individuals in the community permit them to smoke, they as deriving their right under you, they are encroaching in a space that you gave me exclusively. And that has been a theory that tenants have used to fight against exposure secondhand smoke. There is also laws pertaining to disability and fair housing laws that actually protect individuals who are what they call hypersensitive to smoke. That's a clinical a disability that is recognized. And actually, so as opposed to the idea of nicotine dependence being a disability, here we have people who have health reactions to exposure to secondhand smoke. And the law requires that in order for a person who has sensitivity to secondhand smoke, the property owner is supposed to take reasonable steps to ensure that they mitigate the circumstances that exacerbate that condition. So a recent case, well, maybe 2018 is not that recent, but a case out of San Diego illustrates this point. The case involved a property management company, which was called Property West Residential Inc. It managed property called the Meadows at Alpine, which is in Alpine, California. And the family that lived in those apartments had a child who had a respiratory disability. And following laws that pertain to reasonable accommodations and fair housing, the mother asked that the family be moved to another unit because the neighbors were heavy smokers. The property manager was like, you guys are asking for special treatment. And the mother, of course, reported the case to HUD and the case to the Human Rights Commission, and the case was solved with the management ending up paying $5,000 and forgiving over $5,000 as well that the company alleged that the mother owed in back rent. And so there are a lot of there's a lot of illegal risks that are involved when you permit smoking. And another thing is constructive eviction. Constructive eviction, of course, goes in tandem with those implied warranties that I spoke to. The conversation that you always hear about meaningfully addressing smoke-free housing is that the risk of eviction. And I think that is a legitimate concern. I think in adopting smoke-free policies, communities should thoughtfully think about how they can achieve health outcomes and mitigate the adverse health consequences that come from exposure to secondhand smoke while ensuring stability for individuals in their homes. That is the most thoughtful process to guard against evictions. But one of the part of the conversation you never hear about is for individuals who live in communities that don't have a smoke-free policy, but they are involuntarily evicted by the presence of secondhand smoke. So constructive eviction ideally means that the landlord hasn't done anything, but they have created circumstances that make the place unlivable, like I was talking about the idea of warranty of habitability. If you make the place unlivable, you essentially evict the person. And so we've heard stories about families that can't live. They have to move out at night and sleep in their car because their homes face issues relating to secondhand smoke. And we know things like there are other legal theories that have been presented, including trespass, nuisance, negligence. So, and another thing is rent abatement. If you relate it to constructive eviction, if you lease a property for a certain rent per month or however long the periodic payment of rent is due, you are guaranteeing that the property that I'm leasing is worth this much. You're getting the benefit of the bargain by paying so much rent. But what if the rent that I'm paying isn't getting me the benefit of the bargain? Meaning I can't really live here because there's so much smoke infiltrating into my living space. There is a remedy for that called rent abatement, which means that the court can actually offset the rent that the property that the resident is supposed to pay in order to match what what would be reasonable or a person would pay under the circumstances. And so, in sum, allowing smoking in multi-unit housing not only unwarrantedly exposes residents to death and disease associated with secondhand smoke, but it is also potential for legal liability for property owners and really exposes them to danger, legal danger. So let's move on and talk about what if knowing this knowing this background information, what can a community do to protect the vulnerable populations from secondhand smoke, while also ensuring that there is equity and justice for people who live in those communities? One, adopt a comprehensive smoke-free law. We've laid out arguments that pertain the health and legal arguments pertaining to tobacco, cannabis, and e-cigarettes. So a comprehensive smoke-free law will capture all these products and restrict them. And the idea is that the properties that are covered shouldn't be selective. So every Liz mentioned, the amount of shared air. As long as you have a community that shares air and people don't have any other way of protecting themselves, there should be a way of an action from the community to protect those individuals who live in those spaces. So I'm talking about apartments, I'm talking about condominiums, townhouses, and the comprehensive smoke-free policy should cover all indoor spaces and common areas. Even outdoor areas should be covered because there are health hazards that are associated if you permit smoking. What about entire grounds? It's permissible, you can do it. But I'm just laying out a range of areas that could be covered by a smoke-free policy because there's no legal impediment. And continually, there's also an idea that there's also need to protect people in mobile homes, even though they don't share attached walls and common ventilation systems. But the idea that smoke can infiltrate from one unit to another creates a compelling reason why mobile homes should also be included in smoke-free policies. As I mentioned, just like the HUD rule, some communities create buffer zones, and so when a community adopts a smoke-free policy that includes buffer zone, that should also encompass a meaningful distance that will protect other areas from drifting smoke. What about designated smoking areas? Some communities do that, others don't. It depends on the needs of the community. So there is not really a one-size-fits-all. I feel communities should be able to craft policies that meet their specific needs. What makes for a comprehensive, the effectiveness of a comprehensive smoke-free policy? And sorry about that. I think I went. So clearly stated implementation and enforcement plans go a long way. The biggest the best way to ensure success is really community buy-in. So ensuring that you address people's risk perception and ensuring that you educate the people affected so that they can take ownership of the law and the policy in order to ensure that they're effectively implemented and enforced. And also, signage goes a really long way because the idea is that smoke-free policies are self-enforcing. And so it's norm creating such that smoking will be the exception, not the rule. And typically, signage that is visible will go a long way to avoid unnecessary violations. And then for enforcement, there are ways through which communities have crafted particular mechanisms that ensure that policies are being implemented in a meaningful way while guarding against evictions. And that is through graduated enforcement and adopting different mechanisms through which people can go back and through which people can be held accountable, but also ensure that they are being taken care of and put on a path to cessation. And then what about existing tenants? Like HUD, exempting existing tenants really doesn't, there's no legal reason or health reason to do that. In fact, if you're going to exempt existing tenants, why you adopt the policy in the first place? Like it doesn't really make sense. You will continue to expose individuals to secondhand smoke. And the idea here is that because the owner is primarily the property owner is primarily the person responsible for the premises, they should have the primary burden of ensuring that smoke-free policies are implemented and enforced. This approach puts smoke-free housing on the same level of obligations that property owners have towards tenants. Like I mentioned, they are implied terms in tenancies, including the warranty of availability. If a property owner is obligated to ensure that the places are livable, there shouldn't be a reason why a landlord shouldn't be held responsible for ensuring that their communities are smoke-free. And then the idea of public enforcement. And there is, historically, this has been somewhat problematic because of how societies have used penal public enforcement processes to enforce public health laws. But we need to reimagine this option of public enforcement. We need to recognize that market forces aren't sufficient to protect marginalized populations' health interests, especially in the housing context. It becomes important, therefore, to seek out ways through which communities can keep property owners accountable to their residents. And, this is not a brand new idea. When laws that relate to civil rights, laws that relate to fair housing have been adopted, have been coupled with enforcement with a public agency. For example, human rights commissions enforce laws that pertain to anti-discrimination. So there shouldn't be a reason why communities can figure out non-penal ways through which they can ensure laws pertaining to smoke-free housing are enforced by a well-funded and educated agency that primarily holds property owners accountable for ensuring smoke-free policy. And this is the approach that HUD has taken. HUD has, if there is a recalcitrant public housing agency, you can report the public housing agency to the HUD field office, and the HUD field office can take action because the public health agency isn't really doing what it's supposed to do under the HUD rule. And so, the case that I talked about from San Diego, where the property owner said, well, this is a special treatment. We can't really move you a different unit. That property owner was held to account by a public enforcement agency. And there's no reason why we shouldn't emulate that, but reimagine it in a health and justice fashion in order to take care of interests pertaining to stability in housing. And then, of course, considering exploring secondhand smoke as a nuisance. Nuisance law is a traditional remedy, traditional common law remedy that requires somebody to say that an action is unreasonably infringing on their enjoyment of property, and therefore it should be abated, should be stopped. And traditionally, nuisance laws don't really square with the laws and the risk with the science and risk presented by exploring secondhand smoke. Cases that have been litigated using the nuisance theory have really put a huge burden of proof on people complaining about secondhand smoke. If a community adopts a smoke-free law, you could declare exploring secondhand smoke as a nuisance. That alleviates the burden of proof that a person who's claiming that they've been exposed to secondhand smoke bear, and by only showing that they've been exposed to secondhand smoke, then they're entitled to the remedy. That alleviates the burden of proof that they're traditionally been have had, and that really opens up remedies for groups of people who could get legal redress through the courts, but have been prevented by the heightened burden that courts have put on individuals. And by calling exploring secondhand smoke a nuisance, communities actually bring the law in line with the science that says there is no risk-free level of exploring secondhand smoke. So all this stuff that I've been talking about, we have resources about this. We've actually developed a model smoke-free multi-unit housing ordinance that kind of captures all this and shows what provisions go into those policies. And then we've also published materials pertaining to equitable enforcement. They can be used by communities and tailor them to the needs of their communities to ensure that they're meeting both the health and the justice goals that are related to exploring secondhand smoke. And so here is my contact information. Like I said, technical assistance is free. We're grant-funded to provide this. So if you have any questions pertaining to secondhand smoke and adopting policies that meaningfully address that, please feel free to reach out to us. Thank you. And I'll turn now back to either Liz Hendricks or Paul Neprath to talk to us about other aspects of secondhand smoke.
I hope everyone's having a good day. My name is Paul Neprath. My pronouns are he, him, his, and I am the project director for the Tobacco Endgame Center for Organizing and Engagement. The Tobacco Endgame Center is a project of the American Heart Association. We are also funded by the California Tobacco Control Program. Our goal in life is to be the technical assistance, resource, and training provider to the California tobacco control community. And we help local communities with support and services and training and resources for them to pass local tobacco control and tobacco endgame policies that help benefit and improve the health of communities throughout the state of California. So that is who we are. I'm going to talk today about the community engagement aspects as it relates to smoke-free multi-unit housing. And you've got really excellent presentations from Andrew and from Liz, and hoping to build on that to really talk about the community engagement aspects and opportunities for you as city and county staff that may be working in multi-unit housing in this policy area, may already be engaged, and maybe you're engaged already with our local tobacco control programs, But I want to take a step back and just talk about the infrastructure for community engagement, because it really starts with the California Tobacco Control Program that we're all involved with. The program is funded from two tobacco taxes, the Proposition 99 tax that was passed by voters in 1988, and Proposition 56, which was passed by voters in 2016 and provides the resources for us to do this important public health work. So it starts at the top with the California Department of Public Health, the Tobacco Control Program that administers this enormous program, which is mature and has been in effect for 30 years since the beginning of the first tobacco tax in 1988. And then just generally speaking, there are two big chunks of work that is funded from the CTCP, competitive grantees and local lead agencies. I'm going to mostly focus on the infrastructure around local lead agencies that I think you'll find helpful in thinking about community engagement and resources that are available to you in that level. The local lead agencies, of course, are, in our case, are every 58 county health department and the 3 cities that have health departments, so Berkeley, Pasadena, and the city of Long Beach, so making up 61 local lead agencies throughout the state. And under the program, every local lead agency has to have a coalition of community partners, many times the funded agencies. And we'll talk a little bit about that, but that is what I want you to think about in the tobacco control program locally, and think and know about that there's a coalition of engaged community partners that can be helpful in ways that I'll describe here momentarily. So I want to just share with you what an example of a coalition might look like, because as I mentioned, it's sort of, this is the ground zero for community engagement. Every local lead agency is required to have a coalition. There are 61 local lead agencies, 61 coalitions, and they all probably look different than one another. So this is an example of what a typical coalition might look like. And again, there are going to be variations on this all around the state of California. But typically, you might have 10 to 15 members in a coalition. You may have county departments that are at the table, like mental health or planning. Maybe WIC is there. Many of the coalitions are engaged by the voluntary health organizations that are the American Heart Association, the American Lung Association, the American Cancer Society, Cancer Action Network. There may be the Americans for Non-Smokers' Rights Foundation, may be part of a community engagement process. You may also have the Campaign for Tobacco-Free Kids. So all of those sort of together make this category of voluntary health organizations. Many of those organizations also are able to lobby and provide support in different ways for community policymaking. I'm not going to really go into that here. We're all in the non-lobbying world in tobacco control. You might also have non-traditional organizations at the table as well. Maybe the Chamber of Commerce, or maybe there's a local labor union that has become engaged with tobacco control. Maybe there's an environmental organization, the PTA, NAACP. But to give you a sense that the local tobacco control programs reach out and engage in other places of the community than might be typical public health organizations. I mentioned the competitive grantees earlier, and so in some coalitions, you may have different competitive grantees. Maybe somebody who is doing tobacco control work in the Inland Empire might sit at the San Bernardino County table. In the competitive grantee world, there are a variety of organizations that have both specific target populations that they work with, or particular issues like smoke-free multi-unit housing, or maybe they do outdoor dining. So a variety of issues are focused on by competitive grantees. They also include our statewide partners at the coordinating centers for African American, Hispanic, Latino, tribal, rural, LGBTQ, and these communities and these organizations really help bring a lot of context and texture to these coalitions where they are able to sit there. And then you might also have the education community engaged with the coalition as well. So the 2P program, Tobacco Use Prevention Education, This is both at the county level, County Office of Education, and or at the district level in the community. So gives you an idea if you're a city or county staffer or a manager or a leader that's working in housing or planning or public health or healthcare or whatnot. This is an idea. This gives you a sense about what the coalition makeup might look like. And I think, as I said, why is that important? Is because their efforts and those program efforts can lead to a lot of stuff that can be helpful in investigating and in organizing policy work around smoke-free multi-unit housing, as Andrew has really laid out so well. So local data, polling and surveys, support development and community partners, and social media. And I'm just going to give you some examples of the local data. There is rich local data available to you. This is two graphics that show some of that local data, but it's really important to reach out to your local lead agencies and the coalitions to understand what is available in your community and in your county for this kind of data. On the left side, you'll see the adult smoking rate for those who live in San Luis Obispo County. It shows it over time. There is a whole host of other data that might be available too for youth smoking rates or youth and adult vaping, e-cigarette use rates. You could have data around youth purchases of tobacco products, underage sales rates. So a whole lot of local data around tobacco. And then you might have a bunch of data that a local lead agency and their partners have developed that deal with smoke-free multi-unit housing specifically. And it might be something like this, which is a really impressive slide. And I know it's really too small to see, but looking at Riverside, this is a graphic that shows, and it's available on their website. So if you wanted to go and look at it, I'd really encourage you to do that. But this shows all the multi-unit housing within the city, and it shows those that have a smoke-free policy and those that do not have smoke-free policies. So again, just an example of the kind of data and information and resource that you may find helpful if you're specifically looking at the multi-unit housing issue. That's local data. There's also a lot of polling and surveys that are available too, both at the local and the statewide level. And Liz mentioned in her presentation the data point about 70% of Californians support smoke-free apartments. And that's critical because it gives you a really good sense statewide about where the support lies. You'll also see from these couple of examples here that there's local polling and survey data available to you as well. Again, this is where you go and visit and connect with your local lead agency and the coalition around these kinds of resources. On the left side, just showing you the Mariposa County data. They did a smoke-free multi-unit housing survey of residents in 2019 that surveyed 60 residents in 3 different apartment complexes. They wanted to know who would support or not support, smoke-free multi-unit housing, and then also to get a sense about some of the other data. So they found, in this case, 7 in 10 Mariposa apartment residents support 100% smoke-free multi-unit housing policy. 8 in 10 would support smoke-free policy, which also includes designated smoking areas. So again, you can get different kind of data points from these kinds of surveys. They found in doing the survey also that 60% of the residents had reported that they are exposed to cigarette smoke drifting from other apartments, and 40% of the residents surveyed have children living with them. So some of these also reflect and support and underscore some of the data points that Liz shared about who is exposed to secondhand smoke in multi-unit housing in California. Again, this is an example, and there are many other local programs that have produced this kind of polling and survey data and can be useful. Another example is UCLA did this exhaustive study in 2019 that looked at, I think, more than 5,000 residents and owners within LA County. They have some really tremendous results as a result from that study that was published. You can find it at UCLA. You can find it at the local lead agency for Los Angeles County. And again, not everybody's going to be able to do the kind of study that was done here through the UCLA project, but it goes to show you that there is sophisticated resources available to you for your community and maybe in your city that you should avail yourselves to. Social media is everywhere. And social media is utilized by local tobacco control programs for a variety of things. And this is, again, something just to be aware of and to know that there are channels for communication to the community that can be very helpful for the development of support, for education, and things that you just want to make sure folks know. So people use social media for all the things you can imagine. In this case, it's used to educate audiences, to provide resource linkages for people, to drive people to events. We find that in a lot of the social media used in tobacco control up and down the state, most of the events, most of the posts are around driving people to events. So town halls or city council meetings or board of supervisor meetings. So again, this is information that's really important to know. All that kind of piles up and leads to the opportunities to educate and drive support and engagement from community partners, those who are around the coalition table, those that are in smoke-free multi-unit or in multi-unit housing specifically, so tenants finding ways through the local programs and others to do intercept surveys at apartment complexes, to do doorknob hangers. That's a tactic that's been used in the past to educate folks about what's happening in our apartment complex, to ask people questions about their exposure to secondhand smoke, and to provide that to a resource and a link, on the doorknob hanger. And so it's important just to know that through these local programs, you have opportunities to reach into the community, reach to apartment owners, reach to tenants in ways that you might not have thought of. And so it gives you some examples of how you might want to do that. I hope that's been helpful. I know there are many, many more ways that we can talk about community engagement when it comes to smoke-free multi-unit housing. And as you get down the road and wherever you are in your efforts at your city or county, I'm hoping that you'll be reaching out to not only our statewide partners, like our organization, also Andrew and Liz's organizations, but primarily to be looking at the opportunities for engagement and resources and local data at the local lead agencies in your community. Thank you. And I will now turn this back over to Liz Hendricks.
Thank you so much, Paul and Andrew and Liz. So we are now in the question and answer portion of the webinar. We have about 11 minutes left, so we'll try to answer as many questions as we can, and we'll make sure to reach out to people afterwards if we don't have time to answer your question. One thing that I've seen a few times, so I just wanted to address, is where the presentations will be located after. So Stephanie is going to send out an email after the Zoom with a resource link to the video and slides and a survey for anyone who isn't able to take it today. So look out for that. That's where you can find the slides and the video link for this. So the first question I thought might be best, Liz, I know that you answered it in the chat, but I thought it might be a good idea, because it's come up a few times, just talking about the difference between the terms cannabis and marijuana, and when you might use a certain term and why you might not use the other in a different situation.
Sure, great. Yeah, no, that's definitely, as mentioned, an ongoing conversation about whether to use marijuana or cannabis. And in the chat, I talked about how some of the primary considerations that are going into our organization, and I know other organizations, consideration of which term to use is understanding that cannabis has really been taken by the marijuana industry as a neutral and business-friendly term, and one that might, seek to decrease perceptions of harm, kind of be kind of this sterile business-friendly term. And then so that's really what led our organization to use the term marijuana, which we've been using for a number of years now. But increasingly over the last few years, people have been bringing up the historic connotations of, issues around racism in the term marijuana. So that is something we have been certainly reflecting on, and that is something that people may also want to take into consideration in their community. We also know that, some states like California, pretty much across the board use cannabis in like the official regulations. Other states like Alaska use marijuana across the board as in their official regulations. We found that Colorado and Washington use both terms interchangeably. And so we're just, as a national organization, we're recognizing that both terms are in common usage. But again, I do think it's very important to have, if you're passing a law, you may want to use what is more standard if you're referring to other laws, referring to state law language. But if you're talking in your coalitions about how you want to message in the community, you might want to take into consideration community preferences. So it's good to have some discussions around the topic.
Thank you, Liz. Okay, so this one is for Andrew. Is there any way to convey this message in more lay terms and not so much law focused? It may be difficult for us to discuss amendments in the community with our advocates and make the case for city council meetings if we don't have this legal background.
That's a great inquiry, and thank you for that. And I'm sorry if I sounded a little bit esoteric. There was no intention to do that. Some of these things really you have to kind of deal with the technical aspects of it. But as I mentioned, we are a grant-funded, CP-funded organization, and we provide tailored legal technical assistance. So I shared contact information. So if there is something that you might want to drill down on and you want us to discuss that, to present that, we're happy to meet with you, communicate, and do a Zoom and talk through different nuances to break it down. So feel free to reach out.
All right, great. So let me take another one from the chat. Looks like this one is for Andrew again, from Jade Lee. I'm sorry if I missed it, but can you take a moment to elaborate more on the teeth code enforcement has when they are the main enforcement entity? Does this type of enforcement take up a significant amount of resources from code enforcement?
So I think what I was laying out personally is to reimagine and recalibrate enforcement tools that have been traditionally used to enforce laws, because this is kind of a new area, and ensuring that we are taking into consideration both the health and equitable aspects of enforcement and how they might disproportionately burden particular groups of people. We might want to think through not just in traditional terms, like in the traditional sense, what has always worked, but also try to recalibrate them. That's why I was drawing examples from agencies that are specifically focused on, for example, housing, and using those specifically as enforcement mechanisms where individuals who have landlords that aren't complying with the law, through which they can be held to account. So for example, like the example that I gave was agencies that enforce anti-discrimination laws that have like a complaint process through which a person can file a complaint and give the particulars of the complaint, and the agency will follow through. So I don't know logistically and in terms of revenue how that works, but I just wanted to help in the audience think through reimagining enforcement so that we're not doing, because this will require like again reimagining how we've always what we've done, what has and hasn't worked. Like so, for example, the criminal justice process really hasn't yielded any positive returns in terms of health results. So we want to think through other ways through which that can be achieved.
All right, thank you. So this looks like it's for you again, Andrew. Any thoughts about secondhand smoke or third-hand smoke indicators? For example, Third-Hand Smoke Resource Center has a DIY kit to test for evidence of third-hand smoke in homes or enclosed spaces. Wondering if the Public Health Law Center has any thoughts about their use, such as enforcement, or have you encountered any lawsuits with these tools used?
That's a great question. For different, there's different technological devices that actually have been devised to detect and ensure secondhand smoke. But I honestly don't know, in a sense, from enforcement, because those are enforcement tools. From a sense of enforcement, how the expense and the process of retrieving that evidence, the utility of it, whether the utility can be could outweigh the cost. So, for example, from, let's say, enforcing secondhand smoke violation using a technological tool or electronic device that monitors secondhand smoke. One, if you're going to use it for enforcement purposes, you'd have to, think about what avenue are you using? For example, if you're going to use it in a court, how do you prove that? Well, you have to have an expert witness. You have to pay an expert witness to come in and prove, because courts aren't scientists. They don't know how these things work. And then how do you indicate that this smoke was emanated from a particular place that violates the law? Like, what unit do you think this smoke came from? So there are different things to take into consideration. But yeah, there have been areas that have used that. And then another thing to think about is the privacy considerations. There are also privacy considerations that you might want to think through. The case that I talked about of the NYC clash versus Ben Carson, one of the things that the court didn't really talk about this, but it said that people who enforce smoke-free housing under HUD should be careful that the enforcement mechanisms don't intrude on the right to privacy. So that's another thing to think about.
All right, so then we have another one from the chat. Do we need to accommodate someone that has a disability and makes it hard to go smoke in the smoking designated area? So I'm assuming if a complex decides to make an area designated specifically for smoking.
I think that is a fact-specific question, but generally speaking, if there is a law that restricts smoking in a particular place, like I said, given the circumstances, given the science, that accommodation might not be reasonable. One, you are exposing individuals to the carcinogens present in the smoking devices. And we know that secondhand smoke is causally linked with different ailments, even including sudden infant death syndrome. And so is that a reasonable thing under the circumstances? And ideally, because smoking is not going to help an underlying disability, you're going to have a hard time justifying that under reasonable accommodation. So I think under the law, calibrating that, I don't necessarily think that will pass.
Great.
Yeah, and to add to that, just the way it's been explained to us by some, especially around usually the HUD rule, but also regarding other smoke-free housing laws and policies about how, whether or not someone gets accommodated, it doesn't have to mean smoking inside the building. That doesn't have to be the accommodation. And some of the accommodations that people were managers have explained to us that they've used have been to, create an outdoor smoking area that is more accessible. They've put in, lighting and a ramp and a handrail so that people with mobility challenges have been able to access it easier. Sometimes they've, connected people with nicotine replacement therapy at night to help them. So, looking at what it might look like for an individual user can maybe help come up with some creative thinking around the issue.
Thank you, Liz, and thank you, Andrew, for your answers. And it looks like we are at time. So any questions that we didn't answer, we can reach out to those specific people with the answers to those questions. Stephanie, I didn't know, did we need to say anything about the survey?
Nope, just a survey will pop up at the end of today's webinar. If you could please just take a couple minutes to fill that out, that'd be so appreciated. I'll also be including that survey link in the email with the recording and slides tomorrow. So if you could either today after the webinar or tomorrow, please take a couple minutes to fill out the survey, that would be appreciated.
Perfect, thank you. Thank you all so much for joining us. This was a pleasure. I'm glad that so many people were able to join today. Thank you all.